Eric has taken a special interest in the unique pelvic floor, bladder, bowel, and sexual health issues experienced by individuals with Parkinson's. That's been part of our lives. That's been one of my wife's big challenges too. She's on the faculty at Herman and Wallace Pelvic Rehabilitation Institute and has authored a 2-day virtual course in Parkinson's disease and pelvic rehabilitation developed for pelvic health clinicians to further their knowledge for best practices. And it's my pleasure to welcome Erica Vitek. Thank you.
Hi, everyone. Thank you so much for having me at your group. This is my first support group, not in the state where I'm from. I'm from Milwaukee, Wisconsin, and I've lived in Wisconsin all my life, grew up here, and I've been an occupational therapist for over 20 years now. And I work in downtown Milwaukee at a large hospital in our area. And when I first started there, I was introduced to Parkinson's disease as an area of practice. We were actually an expert or a specialty center at the time. And our physician now actually has left and moved the Parkinson's program to one of our more main hospitals, but I'm still greatly involved in it. This is pretty much what I do. I see people with Parkinson's every day, and I'm so grateful that you guys reached out to me and that I'm able to share some information with you today. I have some PowerPoint slides to share with you and go over some of the knowledge that hopefully you can take with you today and start using right away. And I'd be happy to also take questions today. So I'll go ahead and get started on just some of the ideas of the day, and then we can get right into it. All right, so let me see if I can get my first slide. There we go. So kind of some of the things that we're going to talk about today are going to be related to what really are the pelvic floor muscles. We'll talk about what normal bladder and bowel function is. We will talk about how the pelvic floor muscle contributes to bladder functioning and bowel functioning, and what are the common bowel and bladder symptoms experienced by people that have Parkinson's, and maybe some of you have experienced some of these things. We're going to just explore the causes of bowel and bladder symptoms in Parkinson's. What really is the reason behind why these things happen, so we can put some sort of information to that to help you really understand why your body may be doing some of these things. And then we're going to talk about some real life kind of things we can just put into practice right away to help your bladder and your bowel, and other ideas on, how to use your pelvic floor better, as well as some other just techniques that you can take away with you today. So the presentation that you're hearing today, we have a very active Parkinson's community here in Wisconsin. We have the Wisconsin Parkinson Association. And so I do a lot of presentations for them. I travel around the state for support groups here. But again, this is my first one for a group in California. So hopefully you guys enjoy it. All right, let's dig right into it. So the pelvic floor muscles are basically a group of muscles that sling the base of your pelvis. So they go from the front of the pelvis and then to the back. So starting at your pubic bone, and then they go to your tailbone and form like a sling or a hammock between your legs. And they have 5 typical functions. I like to call them the 5 S's. It makes it a little bit easier to remember. So the first function being sphincteric, meaning it has squeeze control of the area. So it helps control urination, bowel movements, release of gas in that area. Also provides support. So it acts as a shelf at the base of the pelvic area to really support all the organs. So the bladder, in females, the uterus, in males, the prostate, and then the rectum and the colon. It has a sexual function, so it participates in having an erection and orgasm. It also participates in stabilization. So it's part of our core. If you've heard the term core before, like being typically like your abdominal muscles, but it's really part of your core. It participates in support and posture and balance. And then it also acts as a sump pump. So it helps with circulation and blood flow and fluid back toward our heart from our lower body. And so this is a side view of what the pelvic floor muscles look like in male and female. So when we look at this first one here, here is going to be the male pelvic floor. And you can see here's the pubic bone right here. And the red is the pelvic muscle and goes back to the tailbone right here. And in the male, the urethra, which comes out of the bladder, so bladder here, and then the tube that comes out of the bladder is the urethra, goes first through the prostate in a male. And then the urethra goes through the pelvic floor muscle. So it lies right below the prostate. And then you can see how it also surrounds the emptying area of the rectum and colon. So right around the anus area. And then on the other side of the screen here, this is the female pelvic floor. So very similar, but the anatomy is just a little different for what it supports. So you have your pubic bone here. You have your sling of muscles, pelvic floor here in the red, back to the tailbone. And then you have the bladder. The urethra in female is much shorter. The uterus, and this is the vaginal opening here, and then the anal opening here that empties the colon and rectum. So we have 3 areas there that pass through the pelvic floor muscle. So the normal bladder can typically hold about 2 cups of urine. So if we want to think about that in milliliters or cc's, that's about 400 to 600 cc's. And most people urinate about 5 to 8 times a day or once every 2 to 5 hours. Anything outside of that is considered like an overactive kind of bladder. The first sensation to go to the bathroom is usually when the bladder is like half full. So like 200 to 300 cc's or maybe about a cup of urine in there. And that's when the brain gets kind of that message like, oh, there's something in there. And then you become more aware of it, but you should be able to wait till the time is appropriate. The bathroom is nearby, something like that, in order to empty the bladder. And then complete emptying of the bladder is required to keep away urinary tract infections and things like that. And no leaking of urine at any time is what's normal for the bladder. And waking only 0 to 1 times a night to go to the bathroom. Now, many of you are probably thinking that you don't fit into these categories, but that's how we kind of establish what's normal and what we can try to work toward in the type of therapy that I do with people in the clinic. So one of the first things that I always talk about is enough water, drinking enough fluids. And sometimes if you have an overactive bladder, it's hard to stay hydrated because there's the worry that there's going to be the gotta go feeling and there's not going to be a bathroom around. But it also is really important to keep away bladder infections, as well as to keep the bladder a little calmer, because if you have urine that is really, really yellow, like at the bottom of this scale, really, really dark in color, then that's looking more like a dehydration kind of thing. And the bladder can actually become a little bit more overactive when you're dehydrated. And so we want to kind of be somewhere in that light lemonade color, kind of between that 3 and 4. And typically what I recommend for people, and what is kind of in the literature now, is instead of just saying 8 glasses a day, which has kind of been the standard recommendation over time, is we say half your body weight in ounces. So if you can kind of shoot for half your body weight in ounces and try to spread it throughout the day rather than loading lots of fluids all at once, that can be really, really helpful to kind of keep the bladder in more of a calm state. And so in order for the bladder to do what it should do, the pelvic floor muscles play a really big role. And so we don't have direct control over the bladder itself yet through these muscles, that sling of muscle that I showed you. So the bladder really is supposed to store urine. And when it stores urine, it is in a relaxed position. It should be able to fill with urine and be relaxed. And the pelvic floor muscles are contracting a little. The sphincter is closing a little bit. And we don't really have to think about it. It's kind of an unconscious thing. The pelvic floor does its own thing and holds the urine in. There's this transition stage where then we realize, okay, there's some fullness here. Here's that signal, like we maybe should try to find a restroom soon. And we can ignore that urge to go to the bathroom, or we can head to the bathroom and then go ahead and go. To stop that feeling from ramping up or from it to become like a leakage, we can actually inhibit the bladder or slow the bladder down or calm the bladder down by contracting our pelvic muscle, by squeezing that area. And I'm going to talk a little bit more about how to do that with a couple slides in the upcoming presentation here. So we'll talk more in depth about that. And then with emptying, when we sit on the toilet or we stand, if we stand to urinate, males and then or females sitting down, the bladder actually contracts. So the bladder is a muscle itself. So the bladder will squeeze to get the urine to come out, and we can then relax our muscles to make sure that happens effectively. The bladder should be doing all the work. We shouldn't have to strain or push or use effort. And so when we kind of think about when the bladder goes wrong, kind of when the bladder isn't behaving itself, we can kind of think about it in a couple of ways here. So in these pictures, this one right here, this bladder with the little kind of exclamation-ish kind of points on the outside of it, is that overactive bladder, meaning the bladder is actually not completely full. There might only be a small amount in there or a medium amount in there, but the bladder is acting like, oh my gosh, got to get this out right now. So it's kind of got that gotta go feeling, that really, really aggressive urge feeling like you have to go now. And that might result in leakage, or you might be able to get there in time to empty the bladder. This middle picture with the little arrows on the top is the incontinence that we sometimes refer to as stress incontinence. And what that means is that there's something from above the bladder, like a cough, a sneeze, bending over to lift something, laughing. So those are some of the things that if they push down on the bladder from your stomach area and push on the bladder, then the bladder might leak out from the stress of the cough or the sneeze. And that may be due to weakness in the pelvic floor muscles that are supposed to be supporting your bladder. And then this picture over here is showing that sometimes your bladder can actually be really full, but maybe the body isn't recognizing that or realizing that it is at that full position. And then it leaks out, and that's called overflow incontinence, meaning the bladder actually is overfilled and it's leaking out because of that. And the sensations might not be accurate. And so there are ways to identify all these different types of incontinence in the clinic with a therapist that's trained in this area. Now, this is one of the challenges that can happen with women, and maybe gals in the group maybe know or have seen a physician that diagnosed you with a prolapse or something similar. This is showing a uterine prolapse as an example. So what we're looking at here is the side view of a female pelvis, and this would be the normal position of your bladder, your uterus on top, and then the colon rectum in the back. But sometimes we get something called a prolapse, where the tissues get weakened over time, or if you've had many babies, and sometimes women that haven't had babies will get this too, just because of how their body is made up, the heredity and where they came from. You can see the uterus actually has snuck down into the vaginal opening here and is kind of real close to the opening there. And then what happens is the bladder kind of gets pulled down with it too and gets squished here a little bit, or you might even get a little pocketing of urine in here. And then sometimes it kind of squishes or disturbs the rectum position as well. And so there are some things we can also do about that in pelvic rehab, but this can complicate just on top of what Parkinson's can do to the bladder and the bowel. These things can complicate the situation. And so that's in females. Now in males, we have to deal with the prostate. So this is the male bladder with a normal prostate, where the urethra, or the tube out of the bladder, is normal size passageway here, and we don't have any obstruction or anything in the way. And as men get older, prostate cancer is very common, but some men just get an enlarged prostate for no apparent reason. It just is as men get older, and we call that benign prostatic hypertrophy, where the prostate gets bigger, but there's really nothing wrong. And so men see urologists for this problem, and there's different tests like a PSA blood test where they can check to see if your PSA is rising. And this enlargement, you can see, really squeezes on the urethra. There are different medicines that doctors will give to try to relax the prostate away from the urethra, but this can cause a lot of problems for men and increase the overactive bladder type symptoms. So I just wanted to share with you those two common things that happen just with aging in men and women. But then we have on top of that potentially the Parkinson's affecting the bladder. So I wanted to share with you kind of the 4 different things that are very common in Parkinson's and related to the bladder and why this happens. So small volumes. And what I mean by that is that it is very typical that a person with Parkinson's will have a very small amount in their bladder and start to already get the feeling of needing to go. And so this causes kind of this frequent going to the bathroom, and then maybe you get in there and you felt like you had to go so much, and there's really not that much in there, maybe only a couple ounces. And so the reason that this happens is the basal ganglia in the brain, where the dopamine is lessened from Parkinson's, is supposed to be the area of the brain that travels down our spinal cord and tells our bladder to store urine or to be calm during storing urine. And so when there's a dysfunction in that pathway, now the bladder isn't getting those signals to be calm during storage. So now the bladder is like, yippee, free reign. We don't have the basal ganglia telling us what to do. We can do whatever we want. And so then you get all these signals that you have to go to the bathroom when really there's only a little bit in there. And there are things we can do about that. And that is what is so great about pelvic floor therapy. And maybe some of you in the group have already had a pelvic health therapist to help you through some of these things. So that's one of the problems. The second problem is this urgency and frequency. So I kind of already mentioned it would cause you obviously to go more frequently, but this urgency is where, you know, the bladder is just so active. It has so much pressure that develops in there because the basal ganglia isn't telling it to be calm. The urgency is developed because when the bladder fills a little bit, there's pressure that starts to develop in the bladder. And then the bladder is just like, got to get this out, got to get this out. And so it causes that got to go feeling to be very aggressive. Now, incontinence is fairly common as well, because that would result in, if you're not making it to the bathroom in time, maybe that's due to mobility challenges from Parkinson's, or maybe the fine motor coordination for unbuttoning pants or zipping and things like that isn't working the greatest. And so now you have, on top of not being able to control the urgency of the bladder, now it's hard to manage clothing and things like that when getting into the bathroom, or mobility like transferring sit to stand, and even getting to the bathroom. And then lastly, very common, nocturia, meaning going to the bathroom a lot at night. So there are actually a number of reasons that this might happen in Parkinson's as well. So one of the reasons is sleep is a challenge for a lot of people with Parkinson's already. And so the circadian rhythm of the body that's supposed to be like daytime, I'm awake, nighttime, I'm asleep, might not be working exactly the way it's supposed to. And so what then happens is what your, excuse me, your bladder is supposed to be listening to that sleep cycle at nighttime. And what's supposed to happen is we produce a hormone at nighttime when we're asleep, and the melatonin is kicked in, and we're in that sleep mode. That hormone is supposed to keep the urine production at a very low level, and then your bladder wouldn't fill much at night. However, if your sleep cycle is not correct and things are mixed up during sleep, then your bladder might be filling kind of like it does during the day. And so now your bladder is filling to these larger volumes. The kidneys are flushing through the urine much faster. And now your bladder is more full like it would be during the day, causing you to get up a lot at night. The other reason would be that the brain is not inhibiting the bladder during storage, just like during the day. So you're trying to store urine at night, yet the brain is not telling the bladder that it's okay to just store it. It's not getting it into that storage mode. And then you get that urgency and frequency really aggressive at night, maybe even at small volumes. And then we'll put this last one into two categories. So one other reason is with aging, just in general, we start to produce a lot more urine at night. So when we're teenagers and young, we might only produce about 15% of our 24-hour urine at nighttime. But each decade that we get older, that percentage starts to go upward for whatever reason. It's just part of aging. And so at 15% when we're younger, we can usually just sleep through the night, and that's no big deal, and our bladder can handle that. Now, as we get older and into our 60s and 70s, the bladder might start producing up to 20, 30 or more % of our urine at nighttime. And so what I usually like to do in the clinic when I see someone is I actually have them measure how much we use like a urine hat that you'd get like at the hospital or at a clinic. And you'd measure how much is coming out each time during the day. And we'd also measure what's coming out at night. And then I have a formula that we can use to figure out how much percentage of urine you're producing at night. And that can be one of the causal factors. And we can try to make some behavioral modifications of shifting some fluids around when you drink things and things like that to try to help that. But sometimes it is part of the physiology of your own body that's causing more urine to be produced at nighttime. Now, lastly, with nighttime frequency, very specific to Parkinson's, is orthostatic hypotension can be affecting this. So any of you in the group that has that blood pressure problem where when you're going from a sitting position to a standing position and your blood pressure drops significantly, that is one of the causes also of frequent nighttime going to the bathroom. And the reason for that is that during the day, most physicians will tell people that have this blood pressure problem to drink a lot of water, right? Lots of water, maybe even salt, maybe you wear compression stockings or something like that. There's all kinds of different things we can try to do for that. And so what happens is during the day, the body is trying to maintain a kind of a balanced state, and it holds on to water to help you maintain a higher blood pressure. And you may even be taking medicine to help you do that. Then what happens at nighttime is you lay down and the blood pressure automatically is a little higher when we lay down. And now the body's like, well, we don't need all this water. And the kidneys flush through this water and your bladder fills significantly faster because now you've had all this water kind of retention during the day to help your blood pressure. And now you lay down at night and now it's like free reign for the bladder to fill and to have to empty. And so if any of you are experiencing that, that might be another reason why. And that one is tough to treat because during the day, obviously, you want to be active, you don't want to fall, you want to maintain good blood pressure and be able to live your life during the day. So I just wanted to share with you some of the reasons because it can be really helpful to even just understand what might be happening in your body. Okay, so those are my slides about bladder. Let me talk about the bowel, and then when we're all done with that, I can go ahead and take any specific questions you might have. Okay, so let's talk about the bowel. So the normal bowel function is anywhere from 3 times a week to 3 times a day. So it's a very big span. But usually we say 1 time a day is pretty darn good if we can be right around that. And some people will say, you know, well, I was always a once every other day kind of person before. Maybe that's normal for you. But we do try to shoot for about 1 time a day as being normal. No leaking of stool at any time, the consistency being soft and formed, and that you have an awareness when there is stool in the rectum. Those are all really good things to have in place to make sure you have good bowel function. Now, this is a chart that I use in the clinic, similar to the urine chart, but now about pooping. So we bring out the Bristol stool chart, and a type 4 is what we're shooting for. So we want the stool to be soft, snake-like, and formed, and not too loose, which would be type 5, 6, or 7, and not too hard or ball-shaped like 3, 2, and 1. So we want to shoot for right in the center of those of that chart in order to have healthy bowels, and the bowels will move the best at that rate right there, or at that consistency. Okay, so normal events of bowel continence. There is something called the gastrocolic reflex. And what happens when we get up in the morning is we ingest food, or maybe we have something to drink, and it kind of initiates this mass, what we call peristalsis. So movement in the stomach, in the colon, everything starts to move around and wake up. And in that process, we may not feel at this moment that we have to go right away, but our pelvic floor muscles are tightening a little to maintain everything and keep everything inside where it's supposed to be. Until then, we become aware. Now we become aware our rectum, which is at the very end, right before the anal canal or the anus, the rectum gets a stretch, just like the bladder. So when the bladder fills up, we have a stretch and we get an awareness. Same thing with the rectum. The rectum stretches. We get a sense of urge or a feeling, and then we're able to tighten our muscle to inhibit or retain the feces until like it's socially appropriate to get to the restroom. Then we have the evacuation stage where the rectum itself is doing all the work. We shouldn't have to strain or hold our breath or push aggressively. And I'm going to be talking about these techniques also to make it easier for you to go to the bathroom if you do find yourself straining or pushing. But the rectum really is supposed to do the majority of the work. And the sphincter and the pelvic floor muscles are supposed to be in a fully relaxed state during that. So we should open our muscles, and the rectum is doing all the work. And then there's this completion of the bowel movement where now the rectum relaxes and we get something called a closing reflex, where the anal canal and the pelvic floor muscles close. They kind of snap closed and then clean out the anal canal, and everything's done and ready to go for the next round of everything moving through. And so this is just a quick little snapshot or cartoony snapshot of the large intestine. So the large intestine starts on your lower right-hand side. So your small intestine's kind of around your belly button, right in the center. And that's all the little tubes. And then it exits into this larger tube, lower right-hand side, goes up your right-hand side, across the middle, down your left, and then kind of sneaks over to the middle again to go out the anal canal. And so in Parkinson's, there's kind of three main areas that we know are affected in the bowel just by having less dopamine. And so the first one is slow motility, meaning that everything in the gut, sometimes even in the stomach, is moving much, much slower. Things are processing much slower. The dopamine slows not only our arm and leg muscles and other muscles down, but it's also slowing the insides down. The colon relies a lot on dopamine for speed and digestion. And so that slow motility can result just from the Parkinson's itself in just trying to get everything through. And that can affect your medication because when you take your medication, your stomach first empties into your small intestine, and that's where carbidopa-levodopa is absorbed. So carbidopa-levodopa gets its action right after it comes out of the stomach and the small intestine. So if you're all stopped up, everything backed up and not moving correctly, or the stomach is empty and kind of slow, sometimes the medicine already has broken down before it gets to the point where it can get into your small intestine and then get to your brain. And so that can be really, really challenging. So getting unconstipated, unbinding the bowel is super important for being able to have your mobility working well with the carbidopa-levodopa. Then the second component of the bowels is abdominals. So when we think about other muscles in the body, like your hands and your legs and walking and things like that, other function, the muscles are not as accurate or coordinated and maybe aren't feeling as strong as they used to. And so your abdominals actually do contribute a little bit to the bowels. And so how I mentioned, your rectum should do most of the work. And the abdominals actually do create some pressure downward to help empty the rectum. And because the muscles in general are slower, that can affect the abdominal muscles. And I'm going to teach you some ways to help use them a little bit better today. And then the last thing is the emptying. So where the pelvic floor is, the sling at the exit, it really has to be able to open. And in Parkinson's, it's very common, for whatever reason, that muscle closes instead of opens when you're trying to go to the bathroom. And so what can make that worse is breath holding. So breath holding also closes the sphincter. And then you're fighting against a closed exit with a breath hold push. And also with the fact that in Parkinson's, there's a tendency for that muscle to tighten closed instead of open when you go, that can complicate matters. So I'm going to tell you how to try to avoid that in the coming slides. We're going to talk about all the lifestyle things next. So here we go. So let's think about some lifestyle things for the bladder first. So first off, I already mentioned drinking water, half your body weight in ounces, really important. Potentially limiting fluids after dinner, except for your medications, if you can, to try to limit that production of urine in the evening time so you can stay asleep longer. We want to try to avoid bladder irritants. So the big ones on the list are caffeine, carbonation, and acidity. So tomato juice, lemon, lime, tomato-based products, grapefruit, things like that. And then your sodas or even carbonated water sometimes can be aggravating for some people. And then that caffeinated coffee, which also can help the bowels. So that's a tricky one sometimes. But even decaf coffee has a little bit of caffeine. So caffeinated coffee has about 4 to 5% caffeine, and decaf has around 2 to 3%. There is something called Ticino that's out there. It's a caffeine-free coffee. I haven't personally drank it myself. However, I've heard it is a little more on the bitter side, so some people may not appreciate that particular kind of coffee to be caffeine-free. There are caffeine-free like herbal teas and things like that, which might even be a little bit better. But some people aren't affected by all these things. So when we make this list of things that could aggravate your bladder, it's not that you have to eliminate them all. It's maybe a test, right? Let's try it out. Let's see, does this irritate your bladder or not? Because one person, it could be detrimental to their day, and another person, it may not really affect them at all. So a little trial and error there. The other thing I want to just encourage you to do is try to avoid a lot of just in case going to the bathroom trips. So it's not that you can't go just in case. So for example, say you're going on a road trip and you want to go just in case before you leave. Not a big deal. Just in case before you go to bed, those kind of things. Those are the times when that makes sense, right? Everybody pretty much does that. But what I want you to try to think about avoiding is doing that all the time when you're just at home, when you have freedom of getting to the restroom. Because what happens is if you always empty your bladder when there's a small amount in there, the bladder gets a routine. It starts to like just decide, oh, this is when we go. And then it gives you the signal when you have small volumes. And so you want to avoid that being a regular thing. But yet when most people would do that, like I said, like going on a road trip, going to the grocery store right before bed, those are the times that you can definitely do that. It's just to do it all day long or to really cater or live around your bladder. You don't want to do that. You want to take your time when you're on the toilet and not rush, because you really need to relax your muscles completely to empty completely. Daily bowel movements are very important for the bladder. The more stool you have in the rectum and colon, and if everything's kind of packed in there, it actually gives the bladder a lot less real estate to expand, right? So the bladder can't really fill that much if it doesn't have any space. And so if we can keep the colon, rectum moving real well every day, the bladder actually will have much more space and be much happier. And when you have an urge, try not to rush to the bathroom. So mind over bladder is part of my title, in that trying to distract or trying to use your pelvic muscle to tighten a little to calm the urge. If you try to walk with an urge, many of you might already know or might be thinking about this, is that if you try to walk when the urge is strong, you may leak or it may start coming already. And so we want to take the edge off the urge. So urges usually are in stages. You get like a small urge and you might, avoid going to the bathroom. It's like, I can wait. And then that second urge comes and it's like, yeah, I better kind of try to find the bathroom, and then we can get it to calm down. And then that third urge comes, and usually that's the most aggressive. Now, people with Parkinson's, a lot of them tell me there's no stages. We just go from no urge to total, like, gotta go right this second. And so really important to learn how to use your muscle to calm that down so you can get to the bathroom in a timely manner. So we'll talk about the muscle in a couple slides here. And then the last thing about the bladder, some real life tips here: squeeze before you sneeze. So this has to do with coughing as well, or laughing, in that you might want to tighten in the pelvic floor area, support your bladder before you sneeze, before you cough, if you can catch it in time, and that can really help a lot. And if any men in the group right now have had prostate surgery, this is actually one of the most common reasons for incontinence after a prostate removal, is coughing, sneezing, lifting, laughing, those kind of things, where now the prostate isn't in there anymore supporting. And then women oftentimes get this as well after having children. All right. And then lifestyle tips for a better bowel. So drinking water, obviously very important for the bowels as well. The bowels need water to work. And so 25 to 35 grams of fiber per day, that can be really tough to get sometimes. And a lot of people will use supplements like a Metamucil powder or a psyllium, which I really like, psyllium powder, or other types of fibers that you might find to try to get your diet up in fiber. The importance of water and fiber is very, very important because fiber works only with water. So if you eat a lot of fiber but don't drink a lot of water, the fiber can't be activated and it could actually stop you up more. So you really have to have your water to activate that fiber. Having a warm drink in the morning can be really important to get that gastrocolic reflex that I mentioned going real well for you. So it kind of wakes everything up, gets the stomach going, and then gets the colon moving along, making room for the next meal or the next drink that you have. Sitting on the toilet at a routine time is best. So even if you don't have that morning urge, it can be really important to try to begin to set a routine to get the body in that habit. So really the best time is about 15 to 20 minutes after you've drank or even eaten something, like say in the morning time. And so you get something into your system and then you go sit on the toilet, best position being with a stool under your feet. One of the most common ones is the squatty potty, but you can use any stool. Leaning forward so your elbows are resting on your legs. So the goal is really to have your knees higher than your hips. And so you're kind of in a squatting type position. And what that does is it fans open your pelvic floor. And now your pelvic floor can be more open. And when the pelvic floor is open, the rectum gets more of a signal. Okay, it's okay to go ahead and release these bowels now. And the rectum can do its work to squeeze and push everything out. You want to relax and take slow, full breaths. And we're going to do some breathing activities in just a moment to help learn how to do that a little bit better. Try not to strain because that closes the sphincter and the pelvic floor. And don't avoid the urge to go. So I know a lot of people don't love going to have a bowel movement in public. But if you do have a strong urge or a strong need and you're in a place where you normally wouldn't feel confident going, to try, if you can, not avoid those times when you do actually have the urge, so we can keep the body and the colon alert to that and going regularly as much as your body needs. All right, so let's kind of talk about finding the pelvis. And so sitting in your chair right now, I'm going to have you put your hands kind of down on your hips. All right, so sitting in your chair, you want to find your hips. So you can put your hands on your hip area here. And what I want you to try to do is, like in the picture, kind of think about if you were pushing a pillow in front of you and you kind of push your pelvis forward and then rocking your pelvis back, or pouring out the bowl forward, pouring out the bowl backward. Okay. And so what that does is really tries to just even wake up that area of the pelvis, just to feel those pelvic movements. Okay. And as you can probably feel when you go forward, if you try to rock the pelvis forward, you can bring your posture up even a little taller. So thinking about like a string through the top of your head, pulling your posture toward the ceiling, making your spine nice and long when the posture goes forward and then back. Okay, so that's kind of just how to even find where your pelvis is. Now, where you're rocking kind of on the seat there, that's where your pelvic floor is at the very bottom of all that. And so when we look at this little depiction here, it's just showing how the pelvic floor muscle connected to your pubic bone and your tailbone, you should be able to kind of feel like it could lift up and in. So if you think about, say you were in a quiet room, which probably it's quiet there right now listening to me, in that you maybe felt like you had to pass gas and you didn't want anyone to even know that you had to pass gas or that you were even squeezing this muscle. So the muscle is very private and very deep. So I want you to kind of think about that back area and kind of thinking like, okay, if you didn't want to pass gas and you didn't want the person next to you knowing you were doing this squeeze, you can do it without moving your butt muscles on the outside where you would like lift off the chair, or your hip muscles tightening together. You really want to go it's very, very deep on the inside. And then in that process, so hopefully you can feel it kind of in the back area. You should also then, when you do that, be able to feel it go and travel toward the front, like if you were going to hold urine back with a urinary urge. Okay. Now, this is just another little picture of that hammock of the pelvic floor. So you have your pubic bone and your tailbone, and your bladder kind of sits in that hammock there. Okay. So it's kind of like it's being held up like by a trampoline, right? So you have like the springs on the trampoline, and the bladder is kind of sitting in the center there. Okay. And so we want that trampoline to come down and open when you go to the bathroom, but the trampoline or the hammock comes up and in when you want to try to hold back. Okay. So there's two different types of squeezes. So on this next screen, get my mouse back over here. I have two screens going to help me. Here we go. So the first type of squeeze is called an endurance hold. And so this is just kind of another way to think about the pelvic floor squeezing closed. So I want you to think about the opening of the anal area or the urethral area where the bladder empties, like trying to pull in nice and slow. So you kind of pull in, pull in, pull in, pull in, and you're closing it. So you should feel like a close, lift, and almost a forward pull toward your bladder when you squeeze strong. So it's close, lift, forward. Close, lift, forward is like a very, very strong squeeze of the pelvic floor. Some of you may be thinking, well, I only really feel like a closing. So we can work toward closing and lifting that muscle to get that full squeeze pressure. And so this type of squeeze and this pace would be more like working on endurance. So trying to get the muscle to hold a little bit longer. So usually when I instruct pelvic floor exercises, this would be considered a long hold. We might hold for 5 seconds. We might hold for 10 seconds, sometimes longer if someone is stronger. Then there's a quick squeeze. So we're going to see that on the other side of the screen here. And this would be the kind of squeeze we need if we cough, if we laugh, if we sneeze. So the pelvic floor has to be quick and quick and quick. And then it has to let go in between in order to get another squeeze, right? So you have squeeze, rest, squeeze, rest, squeeze, rest, squeeze, rest. And so one of the mistakes that some people make when doing the exercises is that you try to, I'm going to switch screens just so we don't go crazy with our, with looking at that. Okay. So one of the mistakes people make is like, they tell me, I can't feel my muscle squeezing. And it might be because you actually haven't let go of the previous squeeze. So think about it like your bicep. If you squeeze your bicep and don't ever let it go, then exercising it would be like this, rather than open, close, open, close. So you have to make sure that you relax the muscle very consciously in between, and then do another squeeze. And then that will get you what you need as far as strengthening. Now, this is one of the images that I have on my biofeedback. So as in my introduction, we talked about how I'm biofeedback certified. So that's for pelvic floor dysfunction. And so I use tools in the clinic, a machine called biofeedback. And typically the best way to use it for adults is it uses like a little sensor that goes internally, either vaginally or in the anal rectal area. So for men, we only put it obviously in the anal rectal area. For women, I could use it in either area depending on the problem they're coming to see me for, whether it's bladder or bowel. And so this little sensor kind of looks like a tampon size, or the anal rectal one kind of looks like a pinky. And so it goes internally and hooks up to a machine that I have. And then it reads your muscle like a muscle recording, like if any of you have ever heard of an EMG. So it's reading the muscle activity on the screen for us, and we both can see it. And so this is one of the images that I use where if the rose is closed, the muscle's closed. If the rose is open, the muscle is open. And it's really helpful sometimes for people that can't figure out if they're squeezing correctly or like, where is this muscle? We can use this technique to help you figure that out. And there's other basic things as well, like just a graph where we can just like make a mountain with the graph and let it relax, mountain, relax, and things like that. So I've got all different ways to utilize biofeedback. Now, another way that you can think about using the pelvic floor for lifting is like an elevator. So these are all just different imageries. Some people respond to one imagery over another. So this is another way to think about if you're on the first floor, your pelvic floor is just at rest. That's where it normally sits all day long when it's just supporting us. But if you think about the elevator, how it goes second floor, third floor, fourth floor, lifting up, that's another way to kind of think about lifting your pelvic floor inward to get that sense of contraction or closing the muscle. Okay. Now, the next thing that I just wanted to mention was sometimes people will tell me they get leakage when they move. So say you're sitting and you all of a sudden get this really strong urge to go and you need to get to the bathroom. So first thing, You don't want to rush. You want to already tighten where the green arrow is, tighten your pelvic floor, kind of get your bladder to calm down first. You can also then continue to tighten the muscle as you stand. Now, I want you to think about letting air out at the same time. So you tighten the muscle in sitting first. So you get that feeling you have to go, tighten the muscle. And then as you stand, let air out while you still tighten. Now, what that does is it brings your diaphragm off your bladder. So it allows for less pressure in your abdomen and then relieves that pressure off your bladder. So getting that exhale, so tighten, and then as you stand, can help just give your bladder some relief. This technique is very helpful as well for people that just have leakage with movement. So if you have no urge, but you leak when you move, this is a really great technique as well. Okay. Now let's think about the bowels. So we're going to go over a couple things with the bowels. So back to how the large intestine is laid out. So it starts on the very lower right side. So right here, the cecum, this is the beginning of your large intestine on the lower right, goes into the ascending colon, the transverse colon, descending, and then out into the rectum, sigmoid, and then rectum. So what you can do is do something called abdominal massage. And what you can do is take either your fist or just your hands and start to make circles at the very bottom right, and then moving up toward the rib cage. So you're going up the ascending colon. Then you're going to make circles going across the body in the transverse colon, down the descending colon on your left, making circles, and you can put quite a bit of pressure there. And then you want to come to the center and down for the sigmoid and rectum. Now, if it's easier to use a fist, you can do that. Some people will use like a tennis ball under their hand and roll. There's also something called a spiky ball, and you'd find that on Amazon for very reasonable. It's got little just spikes on it. It's kind of like a tennis ball, but it's got little spikies on it, and it gives a little more input to your stomach so that the colon can wake up a little bit. So that's kind of nice if you like to use something other than just your hand. Some people, it's hard to use their hand to put enough pressure, and so the spiky ball can help. And so those are just some ideas, and always in the direction of the large intestine. So you always want to go from right and around to your left. You never want to go the opposite direction. A good time to even do this is like in the morning before you get out of bed. Like, let's wake up the colon, let's get her going. Or potentially even after you've drank or ate something, just to kind of wake things up a little bit. Okay, so that's one technique with the bowels. The second technique is constipation yoga. And so let me just show you a couple positions. I don't know if any of you guys do yoga, but I'm going to back up a little bit here. And we can try a couple positions for that. And so what you want to do is sit up real tall in your chair. And what we'll do is just take a nice deep breath, and we're going to bring the arms over our head. So breathing in, arms overhead, breathing out, arms come down. Move some stuff out of the way here. There we go. Breathing in and breathing out. Okay. And then let's breathe in and bring both arms up. And bring your right arm and touch the edge of the chair and just do a little side bend for me to your right side. So your right hand's hanging onto the edge of the chair and you're side bending. Now, what I want you to feel is do a deep breath and kind of feel it go into your belly down here. Make your belly big. And then relax that breath out. And then take a big breath in, both arms up again. And switch sides. Now we're going to grab onto the chair with the left arm and do another side bend. And really try to take that nice deep breath and put it into your stomach. So make that stomach stretch with the breath. Put the air way down in there. And we want to get the air to push on the colon. And then a big breath. And relax. Now with your hands just on your legs, just do a little shoulder circles. Forward and backward for me. And that just kind of helps your rib cage open up a little bit for your diaphragm, your breathing muscle to work real good to help your colon. Okay. All right, then we're going to take a breath in and let's put the right hand up. Breathe in. And then we're going to reach down and across to your left foot. So your right hand is reaching to your left foot. And I want you to put your left arm in the air and you're kind of twisting. You see how I'm twisting around? And you're going to try to look. And now we're going to do the same thing with a big breath into your belly. So you can feel the air into the belly. And then take a big breath in. And we're going to do the same thing on the other side. And rotate down. So left hand is touching your right ankle or foot, and you're rotating up with the right arm in the air and those big breaths into the belly. And just feeling the breath compress on your colon, and then back down, and we're going to bring both arms down to the ankles now. Bring your feet together, and your head is going to just sink into your legs and just cross your arms like this. And this is called the forward fold. And so I want you to feel how it kind of compresses on the belly when you're in that forward fold, and try to breathe into that. So when you're in that position, try to breathe into the fold of your belly. And so the air should feel like it's pushing on your colon, kind of waking things up a little bit. And then slowly come back up to sitting. And then last pose is called the wind releasing pose. I did not come up with that myself. So what we're going to do is we're going to take the right leg and just kind of cradle your hands around your right knee and bring it up as high as you can and as flexible as you are. It's fine wherever it will go. Some of you may be able to even get your heel like rested on the chair. And you're kind of hugging your knee, and you want to fold your body over your leg and do the same thing with your breathing. Get the breath into your belly and try to feel the breath kind of push on that colon when you're hugging your knee. And then we're going to switch and do the same thing on the left. So hug your left knee or kind of cradle with your hands there. And if you can get your heel on the chair, that's fine. Otherwise, wherever your leg will go is fine as well. And then you're going to kind of just crunch over that knee as much as you can and breathe into your belly. Breathe into the fold of where everything's kind of crunched up. And then you can bring it on down. Okay, so that was a quick example of constipation yoga. I know that I'm being recorded, so hopefully if you wanted to kind of look back at some of those positions, then maybe they will help you with your movements and with the bowels. All right, we're almost done. I'm going to go over 3 more slides here, and then I'll take some questions. So the next thing is called 4-7-8 breathing. And 4-7-8 breathing I have found to be so helpful in regards to having a bowel movement. So when you're on the toilet. Now there's all kinds of different apps you can use to time yourself with this, or you can do just basic counting with it. The whole idea is that you're going to breathe in through your nose for the count of 4. You're going to hold your breath for the count of 7, and you're going to exhale for the count of 8. So it's inhale for 4, hold the breath for 7, and exhale for 8. So the whole idea is that with the 4 inhale is you make your belly big. So 4 inhale through the nose, your belly takes on the air and it gets big. With the 7 breath hold, you're putting some compression on the colon. You're holding your breath and you're tightening your abdominal muscles around the colon. Now, it's not one of those breath holds like that kind of breath hold, just more of a gentle breath hold where you feel tightness in the abdomen. And then the 8 exhale is with tight lips. And so I want you to put your hands on your tummy and breathe through your lips like you have a straw. And I want you to feel that your stomach gets tight when you do that, okay? So you put air in your belly and you breathe out through tight lips. Or you could even make an S sound. And you can feel your tummy muscles tighten. That's the kind of pushing that would be much better for a bowel movement than the breath hold tightening your throat. Okay, so let's go through just 2 sets of the 4, 7, 8. So breathe in for 4, hold for 7, breathe out for 8. And I'm just going to play like a little video for us on my end here to do that. All right, here we go. Breathing in for 4. Big belly. Hold. Breathe out for tight lips. Tight lips, let it out. Tighten the tummy muscles. Back to breathing in. Take a big belly with your breath in. Hold for 7. Breath out with tight lips for 8. Okay, great. So that's kind of a pushing technique that I'd like you to consider trying if you need that to help you. And then we're going to make the elevator go opposite for a bowel movement, right? So this is another way to visualize that the pelvic muscle is actually coming down from the 3rd floor, 2nd floor, 1st floor, basement, and is opening. We're going to the basement. So the 1st floor is where we sit all the time, and how we talked about making the elevator go up for a squeeze goes to the 4th floor. But when we want to come down, we have to go to the basement. So that helps to fan the pelvic floor open, and the squatty potty really helps with that. Here's that position on the squatty potty that would be great to have if you could get a stool underneath your feet. This is another thing you can find online. It's called the Toilet Track, and it's a physical therapist, Nari Clemens. She's outstanding. She recorded this great little track. It's like a 10-minute sitting activity on the toilet. Once you hear it one time or a couple times, you'll remember some of the techniques, and I have them listed here. So really, in summary, she talks about using a sipping inhale and then a sigh exhale to relax your body. So what she means by a sipping inhale is you're going like through a straw, and she wants you to still get that big belly like I've been talking about with you. So you use like a straw inhale through the mouth, and then everything just comes out with a big sigh. And the purpose of that is it relaxes your nervous system. And so that can be really helpful for just nervous system relaxation and bowel movements. The second part of what she talks about is a big full breath and holding that hard belly, and then using a panting motion. So what you do is you do that big full breath into the belly, and then, and what that does is if you try that, it kind of creates like a pumping motion on your tummy. And so the diaphragm just pumps up and down, and it pushes on the colon. And for some people, that's very helpful. So I like to mention all these different potentially helpful techniques because not everybody's body is exactly the same. And then she has you do 10 normal breaths so that you don't get dizzy or get fatigued, because these breathing techniques are not easy sometimes. And so that's kind of her sequence in summary. But if you listen to her track, which you can find on like YouTube, it's really walks you through all the details. She also talks about gently bearing down using some of the techniques we've been talking about with not a breath hold, but more of that exhale with effort kind of thing when you have an urge, but to not bear down more than a 5 count each time you try. And best again to do it when you have an urge, because that's when we know the rectum is active and will help you. Okay. All right, great. We made it through. I'm sorry I went 5 minutes over the hour time. I hope it was helpful for you guys. And I'll stop sharing my screen, and I'm happy to take any questions you might have. Let's see. Someone had written in cran-rich pills over the counter for bladder or nocturia. Yeah, I mean, the pills are actually trend to be, from what I've heard, better than cranberry juice, because cranberry juice is just loaded with sugar and it's not as concentrated. So those cranberry type pills can be really, really, really helpful. Okay, great. And then female urologist, great. Thank you for being here. And you prescribe Flomax. Yeah. Yes, a lot of the urologists that I work with in the area here in Wisconsin also do use Flomax as well, and can be very helpful even for women. Yes, I've seen that quite a bit. And I do in my clinic, I have a bladder scanner, so I usually check for post-void residuals, so that can be really helpful to really even know the causal factors. And I'm sure you do that full medical assessment too, and it's great to have a therapist that has that, so you can have someone help you follow up with that. I would hope, just for assisting in the holistic care. Okay, so
I can see if there are any questions from the live audience here too.
Great, yeah, let's do that.
Any questions? Yes. Okay, the question is, he flies long distances and wonders what you could suggest for someone who does fly long distances, like cross-country flights.
Sure. Yes. So with flying, I mean, I would recommend definitely staying away from the irritants first thing before the flight, obviously, with maybe even a couple hour duration prior to the flight, to stay away from those irritants that I listed, or anything that you've noticed is irritating for you, because that's going to cause things to fill up much faster. And sticking with plain water can be very helpful in that regard. The other obviously the other thing would be to have access to either a pad if you're worried about the flying, like utilizing a pad that works for you if you need it. Otherwise, trying to work on maybe some bladder retraining techniques as a general rule with your therapist or with somebody that could help work you through that. And what that would consist of would be to try to increase the time between going to the bathroom. And the way that I do that in the clinic is by using measurements, so we can actually see if we're holding appropriate amounts, of course. So say, for example, if you want to try to have a 2 to 3 hour duration between going, I would want to kind of know what comes out of your bladder at about 2 to 3 hours to make sure it's okay for us to try to work on the holding or the strengthening aspect of things to try to control the urge. And so I would obviously be working on strengthening as well. So strengthening that pelvic floor muscle. So if you were on your flight and you felt like you had to go, recommending using those pelvic floor exercises, or sometimes they're called Kegel exercises, to try to control the urge before standing and walking to the restroom. And so we would go through all those kind of things. I hope that was
maybe aisle seats.
Aisle seats, yes, aisle seats could be helpful too. A little compensation technique there, right?
Okay, yeah. Is this presentation on YouTube? Well, I could answer that, is that the Parkinson Support Group will take the video of this and make that available to anybody from the website. And the first question was actually about constipation on long flights.
Oh, and I was answering it as bladder.
Yeah.
Yeah. Okay. So the best thing to do with constipation is to try to get into more of a habit of trying to get the bowels to move in the morning. So using all the lifestyle techniques that I talked about earlier, and it can sometimes take a while for the bowels to obviously wake up into a new habit. But over time, we can try to get into that habit of trying to go in the morning so that we can ensure the bowels are at least somewhat empty, or hopefully fully empty, before you've gotten on that flight.
Okay. Mark, you have a question. Oh, there was another question came through on the chat too.
Yeah. Yeah, so I had a private question that I was just given permission to answer to the group. So the question was, I urinate in the morning, stand up and walk, and need to go again. So that can be a tricky one. So is it that you haven't fully relaxed when you sat down to go to the bathroom? So making sure that you fully relax the muscles and be able to relax everything. Is it maybe that the bladder just isn't like totally awake yet and things are just starting to wake up? And so you go, but then, now you've stood up and walked around a little and everything reset. And it's like, oh, there's more of a stretch here. So we should try to go again. So one thing that I sometimes will have people do is called double voiding, where you sit and you go and relax as much as you can, but then you stand up and kind of just move around a little bit and then sit right back down again and try to relax again and see if you can get more to come out. So in women, this can be common with a prolapse. So if there is kind of that pocketing of urine with the bladder kind of being pulled in a downward direction, that maybe once you stand up and you've moved around, that there's a resetting of the fluid and now the bladder gets a new stretch sensation and then you have to go again. So I would say that would probably be one of the more common reasons that could happen. The other question in the chat about pelvic floor therapists, yes, many hospitals do have it. The way you can most easily find one would be to either search one. So the American Physical Therapy Association actually has they call them a women's health specialist or a women's specialty certification. But a lot of those therapists see men as well. So it's kind of their pelvic health certification. So they have a search tool. The American Physical Therapy Association has that. Also, Herman and Wallace Pelvic Rehabilitation Institute. So that's Herman and Wallace Pelvic Rehabilitation Institute. That they have a certification as well. And that's one of my certifications. It's a pelvic rehab specialist. And they have a search tool as well, where you can find a provider. And then the biofeedback certification, they just changed their name, BCIA, Biofeedback Certification International Alliance, Biofeedback Certification International Alliance. They have a pelvic floor specific certification for therapists like myself as well. So there's 3 places you could search someone out, or you could, maybe your physician knows of someone, or you could potentially just call your local clinic and find out. These programs are becoming very popular, and there's much more talk about the importance of pelvic health. I can't guarantee they know Parkinson's as well as some. Not a lot of pelvic health specialists specialize in neurologic disorders, but much of the basic techniques work for people with Parkinson's, but I did tell you a lot about reasons why it might happen in Parkinson's as kind of the underlying cause. That would be different in the general population. So that's something definitely to keep in mind. There was another question in the chat, and I'm not sure the spelling on that. I'm not sure what that one is. So I apologize in that question. I'm not sure what that particular, if that's a medication.
Okay. Any more questions from the live audience? And then we need to wrap it up. Mark. Okay. How long should you sit on the toilet before you give up?
Oh, for the bowels?
Yeah, for the bowels, yeah.
Sure. So 10 to 15 minutes, because if you sit and strain or use too much effort for too long, it's not good for your pelvic floor. So actually movement and exercise in general is also very helpful. I mean, I showed you some techniques today, but actually moving around, doing a little more maybe of a warm drink or taking in water and things like that to kind of give yourself a break on the toilet would be good. So if, say, you're trying to get that morning habit to go and you can't get it going the first or second day, don't give up on it. Just keep trying to get your body into a habit of listening to you at that time. And there's a lot other techniques out there of things to do, but a lot of the pelvic floor therapists that are out there would assess your situation and be able to even give you even further information on how to help. But I hope what I gave you today is a great start and something you can find help in right away.
Yeah. Okay. So Jerry started to ask a question on the chat, but didn't finish it. And okay.
What's been your experience with the efficacy of interstim implants?
Okay. Basically the question is, what about interstim implants? and it didn't work for his wife.
Yeah. Yes. So InterStim is actually really great for overactive bladder and can be good for other like pain conditions and things like that. But InterStim can be very helpful. So the whole idea behind InterStim is that it changes the electrical signals. So it's right into the spinal cord, the leads. And what happens is it helps to regulate or modulate the signals from brain to bladder. So yes, for some people that can be very helpful. Now, on my end of things, since I'm a conservative therapist, I don't do surgeries, but my providers obviously would potentially recommend that. I typically recommend using a TENS unit or an interferential current unit first. And I have different setups for those for different problems. So nocturia, urinary incontinence, urgencies. So I have different setups for using a TENS unit or an IFC. So that those units, maybe many of you have heard of those related to like pain conditions or things like that. But there's different settings where you just use an external patch rather than surgery as first to try it out. And in some people, it's like a miracle. And in other people, it doesn't work. So it really is dependent on the person, but I usually try those things first. But then, yes, InterStim. Thank you for bringing that up. I appreciate that. And then Jerry, how does pelvic floor affect sexual function? Very good question, Jerry. So in general, in brief, because I know you guys are obviously have more meeting to get to except me here. So dopamine is our pleasure chemical. So when our dopamine isn't working right, the libido, the interest, the function of our sexual organ, things like that is not the same. It's affected by that. And so the pelvic floor, though, the muscle itself actually plays a huge role in maintaining erection. So when the muscle contracts, it helps keep blood flow in the penis for erection. So when the pelvic muscle is not strong enough, sometimes the erection cannot be maintained. Now, in men, there are so many other reasons why a male might not be able to maintain an erection. Testosterone, blood pressure issues, diabetes, there could be a whole gamut. Aging, just in general, there's so many other things. But the pelvic floor muscle does play a role in maintaining blood flow into the penis for erection, and same for female engorgement, same thing. Now for orgasm, it also plays a role of the contraction to have orgasm. So if you do not have strength in your pelvic floor, so we went over strengthening a little today, if you don't have strength and you can't do those squeezes, that can affect orgasm negatively for both male and for female. So I hope that was a quick answer to probably a longer question, but I hope that's helpful.
Okay. I think we should wrap up now because we need to get to our individual breakout groups. And thank you so much for this wonderful presentation.
Thank you for having me. Appreciate it. You all have a great rest of your day.
Okay, you got a lot of applause here.
Oh, thank you so much. Thank you so much. Okay, take care.